Now we will continue with the next presentation, and the presentation title is Implementation and the Governance Challenges of Digital Healthcare in the Korean Healthcare System. It's my pleasure to invite Dr. Junbok LEE, a research professor at the Yonsei Institute for Digital Health in Yonsei University from Korea. Let's welcome Dr. LEE.
Good morning, everyone. Thank you for coming back for day 2. Yesterday, I showed the digital healthcare service given by Korean government and healthcare companies. I'd like to cover what the Korean government has done as digital health move from wellness to clinical care. I'm going to explain how the shift from wellness to clinical care actually happens. Stage 1 is the passive tracking. The wearable quietly counts steps and heart rate and sleeps and so on in the background. The user does not nothing. It's kind of wellness. The stage 2 is a little bit different. It's prescribed monitoring. Doctor prescribes the application so that the login data becomes the part of the treatment. It feeds clinical decisions. It tracks whether the patient follows the plan, and it measures whether the treatment works. The stage 3 is AI-driven coaching. Here, AI does not give normal advice. It gives predictive and personalized guidance with the right nudge and right person at the right time. This is the shift from simple tracking to toward predictive and personalized intervention. At the moment care crosses into the treatment, so the governance becomes necessary. I'm going to dealing with how the government is building. Before the clinical care, I'm going to start where yesterday and with the public delivery channel. You saw this yesterday, so I will be quick. Public health center gives device to two groups. Adults get the activity tracker and the application, and watches their exercise and their nutrition. Senior gets more blood pressure monitor and glucose monitor. The data goes feed the application to prevent the frailty and chronic disease. This service is kind of wellness. Now it's improving into clinical care for treatment for medical disease. And the movement changes everything because clinical care needs rules. It needs approval, payment, and governance. This is the digital therapeutics. Digital therapeutics is standalone evidence-based software that prevent and manage or treat disease. Medical device delivered as software. Because this DX is prescribed and monitored by physicians or doctor, it has an advantage in sustaining continuous use. DTX must pass 3 checks. This is the DTX ineligibility determinant in Korea. First, it should be standalone software. It runs on its own with no special hardware. Second, it should be to prevent and manage or treat disease. So the products need to be classified by ICD code. And third, it should be developed based on a scientific base. Real clinical evidence like papers, guideline, or trial data. If the answer is all yes, it qualifies as a DTX. So but the bar is clear. The bar should be high. It needs a disease level purpose, and it needs evidence. Now look at the right side. This is the profit list. Many of these are mental health and brain condition, as you can see. This is where the Korea's DTX market started and where it's strongest today. But I expect it's to expand to NCD disease, products. Now, strict rules needs a strict guideline. For DTX, KFDA published several clinical trial guidelines about each disease. You can see the documents here. Each one tells our company exactly how to design the trial and how to prove the safe and effectiveness for that specific condition. Look at the table on the right side. It shows the history. It started in 2021 with the alcohol and nicotine use disorder. As I said earlier, mental health and mental health condition has led the way so far, but going forward, I expect more products for NCD disease. You can already see it's starting with obesity in 2024. And 2025, we published about the diabetes. This is the market access path. It shows how a DTX reaches a patient in Korea. DTX has to pass 4 gates. The first is gate is a KFD approval. The product is approved as an innovative device. The second gate is integrated review and assessment. This checks both safety and value. The third gate is on innovative med tech designation. This gives the product a preliminary benefit for 3 or 5 years. And fourth gate is provisional insurance listing. So Korea built the whole process from approval all the way to the payment for DTX. Now let's move to the new frontier, generative AI. The Korean regulatory government is trying to keep up as well. Look at these 2 documents. Both are from KFDA. The first is guideline for approving generative AI medical device. The second one is about a guideline for large language model medical device. So, and this is the picture. This is a big picture. The national strategy of AI and digital healthcare in Korea. The vision is very simple. AI opens a healthy future for all citizens. With to adjust better health outcomes and a competitive AI industry. It runs on 3 strategies in AI in daily life, rapid adoption, and innovative ecosystem. So this is not a scattered pilot, it's one system built together. This picture shows the AI-based integrated chronic disease management ecosystem. The idea is to connect the whole care journey with AI. AI helps manage the chronic disease patient at home. This picture is about it. And AI helps manage AI support the primary clinic, and AI links the one hospital to another for consultation. AI helps read medical images, and AI supports telehealth for people in remote area. And look at the expected effect at the bottom. Better access and efficiency, proof that AI support care actually works. Continuous management for a better quality of life, and even global export. So the goal is not just one application. It's connect to system from home to hospital powered by AI. The Korean government is now funding for R&D that chronic disease management through AI-based data linkage, AI data linkage and analysis prediction. This is a 2026 national project led by KHIP, our health industry agency. The goal is to connect the public health center, the primary clinic and hospital, and the home with AI for diabetes, high blood pressure, and heart disease. And it's been tested in a real place for given across over 1 year. Why does it matter? Because it's a national test to narrow the health gap between the regions. It takes everything I discussed today and put into a real funded national trial. And this is my last slide. So over these 2 days, I present how the Korea government is responding to digital transformation. Korea built a delivery system and incentives for the prevention and management of NCD. And then it went further and established an approval and reimbursement system for DTX. And now it's building regulation and national project for AI. So I hope what I shared is helpful for your own work and research. Thank you very much, and thank you for listening.
Thank you so much, Dr. Lee, a very enlightening talk.